Child abuse is on the rise in Oklahoma. The latest statistics from the Department of Human Services show the number of confirmed cases of child abuse has gone up in the last 3 years. Last year, there were close to 10,000 cases, but because of underreporting, it's believed the actual number is much higher. As part of Child Abuse Awareness Month, child abuse prevention experts have met around the state to discuss ways to reduce abuse and to learn about the lasting effects it has on victims and society.
Flags waving in the wind in a field south of the state capitol this week demonstrated the alarming reality of child abuse. 41 Oklahoma flags flew in memory of the children who died of child abuse and neglect in the state in 2011. The United States flags represented children who died nationally. Death makes abuse undeniable, but for hundreds of thousands of others, abuse is denied, hidden by victims and their perpetrators. Pam was abused for many years by her stepmother. It began when she was about 3.
She physically abused me. She would grab my cheeks and then bang my head against the wall until I would pass out or have seizures.
Liz was raped at 18. It was the second time she'd been sexually abused.
I was sexually assaulted the first time when I was 12 by a 16-year-old boy that I was dating.
Rose was sexually assaulted by an uncle at the age of 8.
I was pretty well aware as far as, what I learned in school that you tell, so I did, but then it wasn't received well.
The aunt she cried out to did nothing. As a young girl, Toby saw her alcoholic father physically and sexually abuse her mother, who suffered from schizophrenia.
He sexually abused me when I was 12 for a few months, and it scared me. My mother was out of touch with reality, so there was no one to tell. And I really wanted him dead. And then, lo and behold, he up and died. And I was so relieved he was gone, but then I felt guilty because I thought maybe I killed him.
Mike's abuse began at age 8 when he was molested by a teenage neighbor boy.
It's taken a long time for me to sort things out. Felt pretty confused about my sexuality.
That experience led to a life of sexual addiction.
Had relationships that copied or were very much similar to what had happened to me when I was 7 or 8 years old. So
now Mike is a doctor. Toby, a teacher, Rose, a social worker, Liz, a minister, and Pam, a licensed mental health counselor. Renee Marlowe is therapist to all of them.
One of their biggest damages is they don't trust. They don't trust anybody. There's no safe place, and there's no safe person.
Renee refers many of her clients to psychiatrist Jackie Neal. Dr. Neal says post-traumatic stress is common among most of her patients who suffered childhood abuse.
They have nightmares, they can be withdrawn, they're hypervigilant, always thinking something bad's going to happen, difficulty sleeping, trouble concentrating, re-experiencing things, having flashbacks, intrusive memories, just the full range of post-traumatic symptoms.
And those symptoms and feelings dramatically affect the lives of abuse victims.
Feelings of not being loved, not being accepted, not being able to receive love from people who do care about me and who do show feelings of care and love toward me, but I somehow just can't receive it or believe it.
Anxiety, depression, avoidance, taking care of everybody else besides myself.
I knew from the time I was in high school that something was really wrong with me. I didn't know what it was.
Toby says stress caused her to disassociate. Many victims experience the same thing.
I learned how to leave my body and watch it from above, or just completely go away from the event so that I wasn't experiencing it emotionally.
Dr. Robert Block is a nationally recognized expert on child abuse. He serves as immediate past president of the American Academy of Pediatrics and spoke at the Capitol for Child Abuse Prevention Day. He says abuse not only affects emotional and psychological health, but physical health as well.
And certainly being severely neglected or being abused causes the brain to change its function. It changes in shape, it changes in the way the biology works. We also know that the effect of this adverse environment and toxic stress changes the genome.
Dr. Block says science reveals child abuse also leads to disease.
Over time, that just wears on the brain body and causes autoimmune diseases like diabetes. It causes and those are also metabolic diseases. It causes immune diseases. There's some evidence that it may be related to the way genes function to turn on or off certain kind of cancer episodes.
At the Capitol, Dr. Block said there are now reliable economic numbers that reveal how much it costs the state for every child that is abused. Last year, there were nearly 10,000 confirmed cases of child abuse in Oklahoma.
Just the lifetime of the children abused in 2012, we will spend over $2 billion on trying to get them more connected with education, more connected with health care. Their brain health needs to be attended to. They have higher risks for diseases as well as for behavioral issues.
Behavioral issues can also lead victims to prison, with many of their children ending up in foster care.
I was born to a good man and a good woman, but in the eyes of society, I was born to a drunken man and a mother who lied to anybody.
Shiloh Valley entered the foster care system at 13 and aged out at 18. He harbors no ill will toward his parents.
I see him as the people that showed me what not to do in life.
Starting out at age 3, Daryl Conquering Bear was in and out of foster care, and until he found a stable home at age 14, he says the system further victimized him.
You're going to tell a kid that he's not going to make it. You know, your parents are alcoholics, and it gets in your head and it starts building up, and then the doctors and the caseworkers decide you need psychotropic medicine.
Like Shiloh, the neglect Daryl suffered was caused by his own parents' addictions.
It's a cycle, and that her mom put her in foster care, and that her mom was also in foster care, and so it was a cycle that that I'm breaking.
Daryl and Shiloh shared their stories at the National American Indian Conference on Child Abuse and Neglect this week in Catoosa. 700 people attended, each seeking ways to improve their tribal child welfare services.
There has been a historic assumption that the needs of American Indian children and families were being met by the federal government through the Bureau of Indian Affairs and the Indian Health Service, when in fact that's not true.
Terry Cross is the executive director of the National Indian Child Welfare Association. He says tribes are starting to model treatment and prevention programs using lessons from their early cultures. Gil Vigil agrees.
Like in our traditional cultures, we didn't have adoption, we didn't have alcohol or drugs. We had a community that worked together. And when a child was born, the child was not just of that parent or the parents that was born to, it became part of the community. So it was everybody's responsibility to rear that child.
Dr. Block says instead of paying billions to repair the damage of child abuse, the state should spend the money differently.
What we ought to be doing is bolstering DHS, bolstering our community safety nets, bolstering our education, bolstering access to health care, and developing a group of kids that are going to turn into be healthier adults. And that's how you save money, not by being last in everything.
The victims we interviewed hope by telling their stories, other victims will seek treatment, and those who suspect abuse will report it.